Just throw my LinkedIn page. She is in Dubai right now, working and living a life. Just to let you know how far we've gone. Network. Be yourself. In your hospital, your network of friends, are they contributing something positive to your career growth? If not, cut them off. Are you a type of nurse who goes to work and you are thinking of closing and to go to the nearby bar to take few bottles before going home? I'm not saying that you shouldn't drink. I drink. But what is the focus? You should be somebody you sit somewhere to talk. They know that this person has something up here. Talk about healthcare. Your discussion, your network, even out of the health professionals, you should have friends, engineers, medical doctors, teachers. You should be somebody whom younger ones who are still in secondary school, they want to become nurses just because of your influence in your community.
Alice.
As a student nurse, how are you growing? How are you doing? We'll be able to grow you up. We'll be able to build you up. Like I said, we are creating a community. You need a mentor. Like we have guiding counselors in secondary school and high school, we are developing mentors who will be able to guide you. Even if you have, right now, I have a mentor here in the US. With my 13 years of nursing experience, I still have a mentor. With your 15 years of, you still need a mentor. You still need a mentor. Will you mind muting yourself, um, uh, Malonye? Anisel, Neba, can you mute her? Mr. Neba, please. I think she's on duty. Mr. Neba, are you there? Mute this lady. I think she's on duty. So, guys, so this is the most important thing. I invited you guys today so we could discuss. I will give the opportunities for you guys to talk, ask your questions, and you have your experiences to share. We are here to listen. Ask your question. Mr. Neba, are you there? Anisel, please mute yourself. I think the rest of the team is having network problem. Okay, okay, he's done that. Great. Thank you. So, guys, you can ask your questions before we chat a way forward on the subsequent meeting and what we're going to be discussing. So, like I said, we're going to network with. Have any of you heard of the Daisy Award? We've brought Daisy Award in Cameroon is a foundation, an international foundation that awards nurses for their great performance on shift. So when you provide care, a patient is able to nominate that I nominate this nurse to get the Daisy Award due to exceptional service that I received during my stay in the hospital. So in the months and years ahead, we have it in Cameroon right now. We're still building a committee to see how we introduce in many hospitals. We're going to get that going across many countries in Africa. You guys might also be having some of these awards in your areas. You let us know. We're going to work with them. We have to award nurses for their exceptional services. And some of you are going to be benefiting from this award. That is what we are out for. Okay, you can unmute yourself and ask your question. While we round up, I don't want this session today to be as long as it is, since this is our first session. I was just here to build a foundation so that you know what we have in place, and subsequently, we shall be having. What I plan to do is that the subsequent sessions, I will invite 2 or 3 nurses from different countries, and we go online and you share your experiences. We ask some questions, and then we share on YouTube and our social media so others can watch. And we move from country to country, and then we're going to do that with student nurses. They come online. We can send 2 students from each school this week. We're taking two universities, and we have 2 students from each of these universities. We come online, they share their experiences, and we go across. So you're going to link us with most of the universities in your country. We are building a different pathway from nursing and healthcare in our continent. So you know, that is the plan. Do you have anyone has a contribution? You have an idea you want to suggest? Unmute yourself and let us know. If not, we should be rounding up.
Good evening, Mr. John.
Good evening, Maseka. Where are you joining
I
us from?
am joining you from Zambia, Central Province of Zambia.
Yes, my dear.
I think I joined it late because of my work schedule, but then I've been um, following you closely. So the last time we had a discussion, you talked about like for I'm not sure if this is what you've been talking about today. Like in my case, I decided to enroll for a degree because I think you mentioned that in the UAE, I need to have one needs to have a degree in order for them to practice as a registered nurse. But then if one has a diploma, they can still